All right, so in this video, we're going to go over birth to 3 months activities you can do with your child. Normally, I don't like to use motor milestones as determinants for which activities you'll do at what age, but particularly at what developmental level your child is currently presenting at, what activities might be more indicated versus not so much. So the first thing is head control that I really want to focus on, keeping in mind that an infant's head is much, much larger in proportion to their body than an adult head versus body. So you may have to give quite a bit of support throughout, and I can have my hand positioning in this fashion as I hold the child on my thigh or in my lap. And all we'll start with are just some gentle rocks back and forth. If you'd like and you feel more comfortable doing so in your arms, you can kind of lean back a little bit, and then they don't have to fight gravity quite as much. And as you rock side to side, the child is responsible for doing slight bends to keep their head upright. You can even do a little bit of a forward rotation, a forward lean and a backwards lean. If you lean backwards, you will want to bring your chest away from the baby's posterior skull. That way they are a little more reliant on having to keep their head forward and up rather than down and resting on you. We can even induce a little bit of a rotational component here. I can hold the child with this grip here, and my finger, if you can't quite reach, you can use this grip to support a little bit on the side of the child's mandible and the lateral skull. And then from here, I can lean forward, and with them looking at another caregiver or a TV, they can do a little bit of that rotation. And you just want to be very mindful that you're not going to poke your child in the eye at any point. So that will cover sideways, forward and backwards, and a little bit into rotation. Primarily at this age, I do like lateral, and I kind of am less focused on the rotation or even the forward and backwards. The other thing we can do for head control, which is a bit more common, is we can have them go onto their tummy, and we can prop them up into a supported or a facilitated prone position. So in this case, I am cupping both shoulders, and I'm aligning both forearms so that they are in place in this fashion. And from here, the child can try to lift their head off their forearms or their hands or the ground to look up. They can even survey their environment. And this, if they do engage in rotation here, it'll be more effective than the earlier activity of having them rotate in this fashion here. Now, that is the prone on elbows. It's also excellent for shoulder stabilization. The other thing you can do is lay them completely prone on their belly and let them struggle for a second or two trying to clear their airway. Now, this is for really, really young children. You want to definitely be supervising the child at all times to make sure their airway is still patent. And for rolling, we can do a facilitated prone positioning, and we can guide them through the process of a full roll, whether it's segmental or not. But facilitated prone to supine in this particular instance is not with the expectation that the child will do this independently. The roles that a child should perhaps be able to induce on their own is perhaps going from sideline to supine. So you can pre-position them in a sideline position, but you do really want to make sure that their bottom arm is pulled forward and they can easily just gently rock over. Mainly why I mention this is if you start with the child in prone and then you rotate them into sideline, sometimes I see caregivers forget about the bottom arm and it'll get kind of stuck. And I don't want any anterior capsule displacements from the shoulder with the child just vaulting over that arm or being guided into a prone to supine roll. So with them in a sideline position, we'll draw their arm forward, and then we'll let them practice rolling onto their back. To do this, you can stimulate it with a toy and drift it over in a rainbow arc. Or you can do it with your own face and play with the child as they follow you. For midline orientation and midline play, sideline, Acclimation. You can have them up against a wall or a pillow or the edge of a couch. You can have your thigh blocking them. And here they can just play with a toy, a rattle, and in this fashion they work on reaching to midline. You can even start with some elevation by drawing the toy upwards a bit more. And in doing so, they can bring hands to mouth as well, thumbs to mouth, a little bit easier than they might be when they're completely supine. So for the next thing, anterior chain control, what we want to consider is that you can do this in a couple fashions. If it's easier to balance on your thigh, you can do that and you can drift down. As I drift down, my fingers may come away too to increase the amount that they have to fight against gravity, thus strengthening their anterior neck musculature. You can do it in your lap here, and you can drift down in this fashion as well, and you can help draw their shoulders slightly forward, and their head will have to come up so that they can see your face. You can even do this in your arms here, and you can do a rock back by drifting your elbow a little bit away the whole time. I'm giving a little bit of support with the hands, and I'm also kind of letting go a little bit, not very abruptly unless you're wanting to elicit some sort of reaction for that stability or that muscle activation. In some kids that works wonderfully, and then others, they're just so relaxed or hypotonic that it doesn't quite induce much change. If you are just wanting to isolate hip and core control, what you'll do is have a temporary stabilization of their lower extremities, and you can kind of do a little bit of a quick drop. You can even elicit a recoil reflex in the same position. I can push, hold for 5 seconds, and then bring the feet away quickly, and their natural response should be to recoil and draw both knees to chest. Yes, that primarily engages the hip flexors, but it'll secondarily also engage the abdominals. For posterior chain, the best activity is going to be tummy time. Getting them accustomed to tummy time at this age is highly influential for the back of their neck, their back muscles, a little bit of the glutes. They can work on lifting arms off the mat. They can work on surveying their environment in this position, like we mentioned earlier, with a prone prop on forearms, or just cervical rotation for airway clearance. But in this position, always, always, always at this age, we want to supervise the child 100% of the time, just in case. And we also don't want to practice on very squishy surfaces, so perhaps going on a mat on the floor might be a little more appropriate. And if you ever do, for whatever reason, leave the child unsupervised, don't have a pillow nearby or a series of blankets that they might smother themselves in. So if your child is having a bit of discomfort just laying flat on their belly on the ground, you can modify this. If you'd like, you can lean up against a wall or the edge of a couch. You can be in a recliner, and you can have the child just practice being on their belly, on your belly. They look up at your face, you look down at them. This is an excellent one if a baby has been recently introduced to a G-tube. To advance this and to add more pressure, you can go fully into a supine position and have them play with you here. Let's say you prefer a different positional setup. You can do this with your Criss-Cross Applesauce seated positioning. And if there is a G-tube and that is the primary reason for discomfort, wedge it right in between your thigh and your calf, or the empty space there. And it'll be on this side most likely, so you will perhaps want to be using your right knee. And when you align the child here, the higher up you are, the less emphasis on pressure and into their tummy, so the more comfortable they might be. And then as they get more acclimated to the position, you can go into a more gravity-dependent position. Again, you can have a rattle or a toy so they can practice cervical rotation and so forth here. Other than that, another fashion of tummy time that I really enjoy is where both parent and child are on the floor and they are looking at each other and playing in this fashion too. Again, this will really accentuate looking up, and it also just changes their environment